Hello, I am Dr. Ajay Choksey, a gastroenterologist here at Zydus Hospitals, Ahmedabad. As a gastroenterologist, I deal with conditions of the gastrointestinal system, which includes the food pipe, the stomach, the intestines, liver, and the pancreas. Today, I will be talking to you about some of the common GI, we use that as a short term for gastrointestinal, some of the common GI symptoms for which most patients do attend our OPD. When people have GI problems, they generally try to treat it themselves. They might make some change in the diet, they might try some lifestyle changes. For example, if somebody is suffering from, they think they're suffering from acidity, they try going on a bland diet, they try drinking more milk, and then what happens is that they might get frustrated with it. These changes they make are not consistent. They then go to a doctor, they start some medicines, and then afterwards they stop the medicines, and then they get back to their own symptoms. So going ahead, I'll be talking about the scientifically proven and advices, and also certain things which are backed by studies. These include exercises, diet changes, and lifestyle modifications, which can help you manage your GI symptoms much better. Today, I'll be talking about reflux, acidity, we call it as dyspepsia, but commonly people term it as acidity, bloating, excessive burping, constipation, and I will also be talking about fatty liver. So let's start with reflux. What is reflux? Reflux is when food ingested, that is food which you have just consumed, when it comes back from the stomach up to the food pipe. In certain people, this food may even come up to the mouth, and chronic reflux is associated sometimes with cough and also with asthma-like symptoms. Reflux is increasing in India since the past decade, and this is because of two reasons. Number one is the increasing rates of obesity and also our increasingly sedentary lifestyle. We have a lot of people who are sitting whole day on the desk and working on the computer. Reflux, in a majority of cases, is associated with being overweight or with having extra fat on your belly. There are a number of ways in which being overweight promotes reflux. I'll explain you two of the ways in which it does. One is that when you have extra belly fat, the weight of the fat over the belly tends to push the food from the stomach up into the food pipe. Also, we have a muscle called the diaphragm, which is our main breathing muscle, and this is located between our lungs and our abdomen. Our food pipe passes between this muscle, and this muscle helps form a valve and helps prevent food from going back from the stomach into the food pipe. The importance of this muscle will come in treatment. But patients, as they start putting on weight, what tends to happen is their diaphragm tends to become a little weak. And because of a weak diaphragm, the wall effect becomes weak, and hence they have more reflux. So, what are the food changes you would do if you are having reflux? Well, number one, the most important is to reduce the amount of fat or oil in your diet. So you have to avoid fat, oily foods. Even if something doesn't look oily, it may actually have a lot of fat. For example, bakery items, cakes, biscuits, you have to avoid these foods. Number two, if you're using tobacco, smoking or chewing, it promotes reflux. Excessive alcohol intake is also known to increase reflux. One behavior which is known to increase reflux is eating very fast. We do not realize, but a lot of us eat really fast to accommodate meal within a busy schedule. So eating fast promotes reflux. What are the lifestyle modifications you would have to do if you have reflux? Well, number one thing would be to increase the gap between your dinner time and the time you sleep. You should have at least a 3-hour gap between dinner and sleep to prevent reflux at night. The position you sleep in. Yes, sleeping on the right side of your body, like sleeping on the right side promotes reflux. We recommend patients with reflux to either sleep straight or to sleep on their left side, because when you sleep on your left side, You place the stomach lower than the food pipe, and that reduces reflux. If you have a lot of reflux, it is also recommended that you elevate the head end of your bed. The easiest way to do that is to put a small brick 4 to 6 inches in height below the head end of your bed. That would elevate your head and lower your feet, and hence help gravity to treat your reflux. Did you know that the type of clothes you wear can affect your reflux? Yes, wearing tight jeans, tying your belt too tight, women who tie their strings, what you call the nada, very tight, wearing tight fitting undergarments and other restrictive clothes worsens reflux. So, what are the exercises you have to do if you have reflux? If you remember, reflux is mostly due to being obese or being overweight, and you have to lose the weight. Losing weight is the best thing and the most effective thing to do if you can want to treat reflux. Moderate intensity exercises are recommended for patients with reflux, but it's important that these exercises be done on an empty stomach or with a little, or you can just take a small amount of a beverage in the morning. Doing high intensity exercises or lifting heavy weights like weight training, doing these exercises in the evening can actually worsen reflux. Some patients, even when they're doing weight training or high intensity exercise, may experience a worsening in reflux. So moderate intensity exercises are recommended. If you want to go for high intensity exercises, you better try and see whether it's working for you. Another thing which can be done is to have a walk at night after dinner. Just remember, this is supposed to be a mild activity. It is supposed to be a leisurely stroll. A slow walk, relaxed walk after dinner has an effect of increasing gastric emptying. That is, it empties out the stomach. But if you make your night walk after dinner an exercise and start walking vigorously, that again is going to worsen your reflux. So be careful of that. There are some patients with reflux who have a complaint of excessive burping. They might burp sometimes 20, 30, 40 times after a meal, like Odkar, Dakaryana. They get very distressed by it, and it is generally associated with reflux. These people who are burping too much, essentially what they're doing is they are swallowing some air into their food pipe and again bringing this air out, and it becomes a habit, and it's done so subtly that they don't even realize that it's being done. Troublesome reflux and patients who have a lot of burping, there are two particular exercises which have been studied and found to be very effective. One of them is called Inspiratory muscle training, and the second one is called Diaphragmatic muscle breathing. These are two exercises which you learn from a physiotherapist. They teach it over a period of time, and you have to practice it daily. This essentially starts working the diaphragm and helps the diaphragm become more strong and form a better valve between your food pipe and your stomach. Yoga. A lot of patients ask me, can I do this yoga? Can I do that yoga? Well, there have been studies on yoga, but one particular yogic exercise has found to have benefit in reflux, and that is Kapalbhati. Yes, that popular exercise which was made so popular, we had grounds full of people doing this exercise. This exercise has been found to have effect along with medicine, but this exercise cannot be abused. You cannot be doing it 50, 100, 150 times the way people claim they're doing. That is in fact very harmful. This exercise has to be learned from a proper yoga teacher and has to be learned properly. People who have hernias, who have chronic liver disease, cirrhosis, cannot do or should not do Kapalbhati. If you have a cardiac condition, a lung condition, or if you have epilepsy or any other neurological condition, it's better you check with your neurologist, because this exercise should not be done with those conditions. Now we come to dyspepsia, or what commonly people refer as acidity. These are symptoms which come after consuming food. Some people describe this condition as burning, acidity, heaviness. Some people are not able to describe it properly. A lot of people are actually just uncomfortable after eating food, and we term this as dyspepsia. Normally, when we eat food, as the food goes into the stomach gradually relaxes to accept that food. At the same time, the stomach starts producing acid and digestive enzymes to start digesting the food. Any problem in any of these functions can lead to problems of dyspepsia. So if you have dyspeptic symptoms, you might require medications for the same, but yes, there are things you can do to help it. In the food, the number one thing which you will change in your food will be to reduce the amount of oil. As the same for reflux, you have to reduce the amount of fat in the meals, because it has been found that fatty meals or meals which have a lot of fat increase the sensitivity of the stomach and can increase the sensation of pain. Beverages. Drinking 2 to 3 cups of strong coffee a day or 3 to 4 cups of strong tea every day can worsen dyspeptic symptoms. Consuming a lot of alcohol is also associated with dyspeptic symptoms. Many people find that drinking a small amount of alcohol actually improves their appetite and they feel better. But drinking alcohol every day, drinking more than 7 drinks a week, and if you have dyspeptic symptoms, they will probably subside or improve if you stop the alcohol. Milk. A lot of people, when they have some abdominal discomfort, will drink a cup of cold milk and it gives them instant relief. But majority of us Indians, adult Indians, are lactose intolerant and we do not digest milk well. Drinking large amounts of milk can cause more bloating or can worsen the symptoms after some time. There are some people who find that they have they have worse symptoms or more pain when they consume wheat or gehu, that is wheat or wheat-based products. If you have noticed that you have more symptoms with wheat, then I strongly suggest you meet your physician or gastroenterologist to make sure that you do not have something called celiac disease. Spice. Now, Indians and our spice in our food. We all love spice in our food. But there's a difference in having spice in your food and having spicy food. Having very spicy food every day will sooner or later lead to dyspeptic symptoms. So anybody with acidity or any such symptoms, we generally advise the patient to reduce the spice in the diet. But at the same time, we do not want you to go onto a completely bland diet. We have patients who come and say, oh, we stopped all our food, we're eating just boiled food and I'm still not feeling good. Well, the problem is, if you change your diet so drastically to a diet which you're not enjoying, you are not going to have improvement in symptoms. So we do not recommend drastically going on to a completely bland diet. Yes, do reduce the spice, but to a moderate degree that you can enjoy the food, but don't eat unpalatable food. That will not make you feel better. You might not enjoy eating and you might be worse off. In fact, an interesting study was done in Spain where they showed that people who had dyspeptic symptoms on very bland food, when they shifted them onto a low spice diet, they quantified that as 2 to 3 grams of spice a day, they actually improved. So that's how we have to be a little moderate in our approach. There are some people who face a lot of bloating. Like they might not complain of acid, they may not complain of acidity or anything, but they just complain that their stomach feels bloated all the time, they feel heavy, they feel their stomach bloating out. Some women even complain they look as if they are pregnant. This type of bloating can sometimes be troublesome to treat and might not respond to certain medicines. Patients with this sort of bloating, we recommend they go on to something called a low food map diet. So what is food map? Food map is a term, it's a short form for a type of carbohydrate, and this type of carbohydrates have a character of when they get into the intestine, they start fermenting and they produce a lot of gas and hence causing the bloated feeling. So if you have these symptoms, you can try a low food map diet. Low food map diet involves a lot of food items to be restricted and a lot of food items which you can freely have. You need the help of dietitian to help you with this, and our dietitians here at Zydus Hospital can help you with that. Then I will be coming on to constipation. Yes, a large population of a percentage of our population complains of constipation at any point of time, and constipation is mainly that these people feel that they are not passing enough stool, they are unhappy with the frequency, they feel they should be passing more stool, and a lot of people get very obsessed with the amount of stool they are passing. So if you feel you're constipated, there are certain things you can do. The number one change in your diet would be to increase the amount of fluid intake. It is recommended that you take around 1.5 to 2 liters of fluids per day. It's important that be taken throughout the day. A lot of people just drink 1 liter of water in the morning, and that's not really going to help. You have to drink your fluids throughout the day. Also, you would have to increase the amount of fiber in your diet. What's fiber? Fiber is a type of carbohydrate which is not digested in our body. It adds bulk to the stool and helps move the stool through the intestine and has an effect of improving constipation. Fiber is found in raw vegetables, raw fruits. They're even found in whole grains. Even isabgol is a fiber. An important thing to remember is when you try to increase fiber in your diet, you have to do so gradually. And you cannot just start with one big bowl of salad and expect you to have great motions the next day. No, you have to increase the fiber gradually through the days. And when you start increasing fiber, you have a beneficial effect after 1 or 2 weeks. So you have to be prepared that this is the way. You have to be consistent, and after 2 or 3 weeks, you might have better motions. When you're trying to increase the fiber in your diet, it is important to drink a lot of water, because if you're taking a high fiber diet but drink less water, you probably could have the opposite effect. There are some patients with constipation who may complain of a lot of pain, and we term that as patients with irritable bowel syndrome. They have constipation, but they also have a lot of pain, and this pain is relieved when they pass the stool. So in these particular patients, patients with IBS, there have been studies of a lot of what lifestyle modifications can help, but the consistent effect has been found with yoga. They have found that consistently practicing yoga in young people with IBS can produce symptomatic relief after 6 to 8 weeks. Here also, it's important. It has to be consistent. It has to be done by a trained individual, under training by somebody for 6 to 8 weeks. In general, constipation responds to most types of exercise, but that also takes 2 to 3 weeks to have effect. The most effective type of exercise you can do in constipation is any sort of aerobic exercise. Aerobic exercise meaning running, jogging, cycling, or swimming. These exercises, along with the dietary changes, can actually treat mild levels of constipation and could avoid a lot of medicines if you have moderate to severe constipation. There is one type of constipation which I would like to mention over here. Some of you might be having it, or you might be knowing somebody with it. This is called a defecatory disorder. These are people who spend a very long time in the toilet. Sometimes they could be sitting 20, 40 minutes or even an hour trying to pass stool. They sometimes require, they use their finger to remove the stool. And these days, sometimes people use the water spout to kind of wash the stool out. These type of patients do not respond to normal treatment for constipation. They need to be evaluated that they might be having some problem around the anal canal, which is kind of avoiding the stool from coming out. And many of them have what is called dyssynergic defecation. This is where the muscles for defecating are not working in a coordinated fashion. So if you have this problem, or if you feel you have to be evaluated. You may require what is called anorectal manometry. That is where we test the coordination of the muscles. And if you have this incoordinated muscle working, then you need biofeedback therapy. That is where we train the muscles to work in a coordinated fashion. patients who are well motivated and can do 5 to 6 sessions of biofeedback therapy ultimately gain long-term benefit and may probably not require any medicine for their constipation. Now I'll be talking about fatty liver as promised. What is fatty liver? Fatty liver is the accumulation of fat on the liver, and as the name suggests, fatty liver is associated with being overweight. And we have a lot of patients come with sonography reports saying that we have a grade 1 fatty liver. What do we do about it? Well, in most cases, a fatty liver can be managed best with exercise. There are medicines for fatty liver, but nothing beats losing weight and doing exercise, because losing weight removes the cause of fatty liver. If you have a fatty liver, in some cases, patients may progress to chronic liver disease or even to cirrhosis. So it's important to check if you are overweight, do you have a fatty liver, and treat it accordingly. And the simplest way is to lose weight. Reducing weight by just 5% can prevent progression of fatty liver disease, and reducing 10% of your weight. It's like if you are 80 kilos and if you reduce your weight by 8 kilos, you can actually reverse some of the damage done by the fatty liver and can probably go to lower grades. Exercise is an important part of treating fatty liver, and we as a prescription prescribe patients 45 minutes of a combination of aerobic and strength training for at least 3 to 4 times a week. This is found to be most effective for treating fatty liver disease. And once you get into a habit of exercising regularly, you probably can make sure that you will not get fatty liver disease again, if so. So these were some of the lifestyle changes I have suggested for most of the gastrointestinal problems. There are also some things I would like to talk to you about, which are called warning signs. If you notice any of you have these warning signs, you better meet a doctor or a gastroenterologist and get these things checked out, because this could be something more serious. If you have noticed significant weight loss, significant loss of appetite, unintended weight loss that is, significant loss of appetite, feeling extremely weak, looking pale, your hemoglobin levels have fallen down, if you feel that while eating you feel food getting stuck in your throat, that's not a good sign. If you see blood in your stool, if you have a family history of cancer in your and also if you have some old parents, or if you are above age of 60-65 and you suddenly have new constipation which you never had all your life, or you have a new acidity problem which you never had all your life, you should be investigated for the same, to make sure that we are not missing out on something serious. So to end this talk, I hope you benefited and can take most of the advice which I have given and help treat your GI problems better. You may or may not require medicines, but using sound advice, every advice I've given is scientifically backed with science and studies, and if practiced regularly would help you get rid of mild problems without medicine. And if you have moderate to severe problems, probably we can start tapering your medicines and probably over time get you off medicines. I am here available at Zydus Hospital for e-consultation if you have any queries, and also if you have any queries related to this live session, please do send a message. Thank you.